I'm Gwynn Geddie. I'm one of the neonatologists here at St. Joseph Hospital. That means I take care of newborn babies, both sick and well. Private NICU rooms, I think, are the biggest change for us. Where we currently are at the Bryan campus, the neonatal ICU rooms are big open bays where you have 4 or 5 or 6 babies all in one room. Here, every baby gets their own private room. I was at a hospital previously that went from a NICU with open bay to individual rooms like we're going to have here. The dramatic thing that I saw there was that before we went to the private rooms, you would see parents come in and stay for 15, 30 minutes. The day we moved to the private rooms, the same parents started staying 2 hours, 3 hours, 5 hours, 6 hours a day. So it is much better for the families, not only just because of privacy, but they're able to interact better with their babies. Well, the purpose of us having a NICU is so that babies who have problems are able to stay here in the community and not have to be shipped out to either Houston or Austin or Temple. By having a neonatal ICU, we are able to keep premature babies, we're able to keep term babies that have problems, we're able to take care of babies with mild birth defects, all here in the local community rather than them have to be shipped out. The one that people think of most is prematurity, but we also, so a premature baby is any baby that's born at less than 37 weeks gestation. But we also have a lot of term babies who need to go to the NICU either because they have breathing problems, blood pressure problems, blood sugar problems is a frequent one for babies who either are large or whose mothers had gestational or other types of diabetes and they're having low blood sugar problems. There is a partnership that has existed for almost 6 years between St. Joseph and Texas Children's Hospital in Houston. That partnership allows us as Texas Children's neonatologists to have ready access to everything that Texas Children's has to offer. We follow the guidelines of Baylor College of Medicine and Texas Children's Hospital when it comes to how we approach and how we treat various problems that babies might have. So we have a uniform approach. And then if a baby has a problem that we can't treat or take care of here, we transfer to one of the 2 Texas Children's hospitals in the Houston area. And we have ready access to the doctors down at Texas Children's since we are part of Texas Children's. We have a working relationship with those doctors. We have 2 full-time neonatologists here at St. Joseph, myself and Dr. Courtney Carmichael Swanner. The newborn nursery is a little bit farther away. Postpartum, where the moms and babies usually are, is over there by the newborn nursery. It's all the same staff, all the same nurses. The lab is going to be the local lab here in College Station, the respiratory therapists. Some of the very experienced respiratory therapists, the ones that have NICU experience, are coming over here with us. I want to put a plug in for St. Joseph. This hospital takes care of everybody. It doesn't matter who you are, it doesn't matter how much you make, it doesn't matter what your status is in life, whether you make $10 million a year or $10 a year. This hospital is here for you. I can't say that for all hospitals, but St. Joseph truly lives up to their values and their mission, in that anybody and everybody gets treated and treated equally here. Right. It certainly is easier access for almost everybody. We're 1 block away from the freeway, not tucked back in almost to the middle of Bryan. So even people who live on the north side of Bryan, it's going to be the same amount of time to get here because all you do is hop on the freeway, zip, 1 block off, and you're here. There are 2 basic philosophies about taking care of babies and moms who have recently delivered babies. One is what's called couplet care or mother-baby care, where the baby goes out and stays in mom's room. And a lot of hospitals very strongly discourage mom ever sending the baby back to the nursery, even though Texas state law requires every hospital that delivers babies to have a nursery and to allow moms to send their babies back if they don't feel good, if they're tired, if they have a splitting headache because they have had a spinal anesthesia and so they have a spinal headache or whatever. State law requires hospitals to do that. Here, we prefer to be more specialized. So we have nurses who take care of the babies and are specialized in taking care of babies, and then we have nurses who take care of moms and are special after they've had a baby, postpartum nurses, and they are specialized in taking care of the moms. We're not trying to have the same nurse know everything about everybody. Everything else in medicine is becoming more and more specialized. Why should we not treat our moms and newborn babies the same way? I've been at hospitals that do couplet care, and I have been at hospitals that do what we do with babies, nurses for the babies and nurses for the moms. And I think that everybody gets better care when you have a nurse that just takes care of the baby and a nurse that is specialized in taking care of the mom.